Hey guys, this is Dr. Ruth live, trying this again. The first attempt, guess we didn't have enough signal, but at any rate, I'm down here in Florida visiting my mom and her little dog Copper, who is an extremely cute 10-and-a-half-year-old toy poodle. And when she adopted him, poor little buddy, the folks that had taken care of him had cleaned him up and gotten him taken care of, but little Bud had such horrible teeth, he was too painful to eat very much. And there he is. He's very handsome now. So, Mom had to get his mouth cleaned up. And unfortunately, as happens with many of these little guys, he had to have all of his teeth extracted, which really stinks. But he feels so much better, and he's able to eat and enjoy life, and his comfort level is remarkable. So that's just one of the hazards, unfortunately, that comes with adopting older pets, is often they've been neglected, and especially for a dog like Copper that was a breeding dog. Some breeders do amazing things and take great care of their animals, but unfortunately many of them don't. And especially for him to have ended up in rescue, that means that, sort of once his use was passed to the person that owned him before, he just got dumped off. So similarly, this Sunday when we get back home, we're going to adopt an 11-and-a-half-year-old English setter who our friend Sally Ferry has been fostering for Above and Beyond English Setter Rescue. And she just is a doll baby. She was a hunting dog, went deaf, and so the fella, instead of, it's just some of these stories just aggravate the heck out of me, and I know they do for you all as well. So instead of just shooting her, he loved her enough that and had bottle fed her, so he took her down to a shelter so she could get adopted out. So Gracie is going to come live with us, and our other dog Esau is about a year older than she is, and he is going deaf. So it's a great opportunity to teach both of them hand signals so they know what's going on and know how to respond to situations, and then to try and figure out some other options like different calls, dog whistles, and things like that may still work for their hearing range. So that's going to be our next pet adventure, is figuring out how to teach two old dogs that are deaf and or going deaf some new tricks, so to speak. So love to hear any suggestions you guys have in relation to that. If you've had a deaf dog that you've had to train, would love to hear what you're doing. Similarly, or maybe not similarly, but I think what gets mistaken for going deaf sometimes is we see these guys get very anxious all of a sudden. And so I was talking with my friends Susan Merritt and Cece Bourgeois, who have Wonder Dog Academy, and I'll post a link below that we did some discussion about how food and drugs and supplements and things like that can help with dogs that are anxious. But be cognizant that if your older pet is suddenly getting anxious, maybe it's going deaf or losing some vision, and that, like us, they begin to feel very vulnerable, and so they may begin to do things that you don't understand why they're doing them. Most of the time, sadly, when people rearrange the house or move, they find out that's when they find out that the dog is blind, because all of a sudden the environment has changed and the dog kind of can't keep up with it anymore. So those are all things to be cognizant of. I had a message from Carmela about her Schnauzer, Lucky, that they found several years ago and brought him home, and poor Buddy was out wandering the streets and almost got hit by a car. And he's really become very protective of her daughter, who has some very, very serious health problems, unfortunately. Sounds like she has juvenile diabetes, and unfortunately has quite a few pretty dreadful side effects. And so Lucky's a pretty barky guy and lets him know when somebody's there who's not supposed to be there, or just kind of generally talks about it, but is very gentle with her daughter. And so the thing that caused Carmela to write in was to ask, what she can do to help him eat. He's not really interested in eating a lot of the foods that she's tried for him and wants to know if the CrockPet diet will work for him. And I think that that is very possible. But the other thing to remember is the two things I just mentioned. One, how's his mouth? If his mouth is super sore, it's going to be extremely painful to try and eat dry food. And so that's what happens is they're often very hungry, but physically just cannot eat because it's too uncomfortable. And then conversely, he may be getting to the point where he's got some sort of a health issue that's making him feel a little bit nauseous. And though he may like to eat, it just makes him feel bad to do so. And so he just kind of holds out for the really good stuff, treats and little bits of nice pieces of protein and things of that nature. So yes, I think that CrockPet diet will definitely be helpful for Lucky, but I think it's also important to make sure that he doesn't have a physical reason for not wanting to eat. And certainly if he is your daughter's companion and sort of nursemaid, if you will, if she's not well, and it sounds like she is having a great deal of difficulty, he may be very concerned about her, and so he's not eating well because he's worried about her and not sure what he can do to help her. So I think it's worthwhile to make sure that there's no physical health issues for him, and then also to to look into doing the CrockPet diet for him so that he'll have a much broader base of nutrition, and often that helps tremendously as far as getting him turned around and eating well again. So Carmela, I hope that's helpful. Sounds like you've got a really tough situation going on at your house, and I admire you for keeping your chin up and just getting through it. And I know sometimes that's the only option, but I hope that's helpful for Lucky. And then the other thing is that's something your daughter can do if she's feeling well enough to help support Lucky, because sounds like he's obviously taking good care of her as well. So hope that makes sense. One of the things that I talked with my friends Susan and Cece about at Wonder Dog University is how diet affects anxiety. And for dogs that have anxiety disorders or become very stressed out with separation anxiety, things of that nature. And that's where getting off of the commercial food can be extremely helpful. So there's a lot of color and artificial colors and flavors and things of that nature when you start reading the labels. That's kind of surprising. And then the other thing is in the Chinese medicine cosmology, often there's too much internal heat, and that's what causes what's considered to be Shen disturbance. So the Shen is the mind, and it comes up and does nutty things when the internal heat is too great. So cooking the food is one way to take heat away pretty quickly. So we don't think about it, but dog food is typically baked and then extruded through a machine, and so that typically creates a great deal of heat just in the way that the food is processed. And then certain types of food cause more heat than others. So for instance, chicken is considered to be very warming, as is lamb. And sometimes those are the things that we need because the dog is sensitive to other proteins. But by cooling the food down, making it easier to digest, things of that nature, we can often help dogs that have separation anxiety and other generalized anxiety or phobias about noises and things of that nature. And then we also discuss several supplements, and oddly enough, the most basic of which is probiotics. So, probiotics are in the news everywhere currently, but the thing that we forget is that the good bugs in our gut actually produce something like 90% of our neurotransmitters, which is shocking when you think about all the stuff that goes on in the brain. But in truth, if the gut flora isn't happy, then the initiating signals from down in the GI tract send skewed messages up to the central nervous system, up to the brain. And if your pet or, for us humans, if we're already having difficulty getting the right signals across, then it makes it tough to get to get things squared away. So probiotics can be tremendously helpful, as can reducing inflammation in the gut or leaky gut syndrome. So that's part of why I'll often recommend using the CrockPet Diet sort of as a baseline for any pet that has some sort of anxiety disorder. And unfortunately, we're seeing that more and more commonly in both dogs and cats. One of the other things we talked about is that we're an extremely dog mobile culture, and so we want to be able to take our dogs everywhere we go. But for a dog that has horrible anxiety or is very fearful about being around people and other animals, things of that nature, going to one of these outdoor dog cafes can be extremely stressful. So that's where working with a trained either dog trainer or behaviorist can be extremely important, so that you can help your pet by setting up small baby steps, and they can experience success and not being so freaked out about things in those small baby steps, and then that allows you to graduate onto bigger steps. But this idea of sort of just going for it and getting them out, long time ago it was called immersion therapy, and they finally quit doing that in people because it often just made whatever they were afraid of, it made their phobia or fear that much worse. So if you're having issues with your pet as far as separation anxiety, or they're very they regard resources out in public, meaning that if somebody or another dog approaches you, they get growly, it's because you're their resource essentially, or they just don't know what to do, they're very reactive and that sort of stuff. That's where it's so critical to work with somebody that's got experience in this field. So I hope that makes sense to you. And check out Wonder Dog University. Susan and Cece are just putting some great information out there. And while it doesn't substitute for working with somebody locally, there's a lot of folks that just don't have access to good trainers. And so these guys can be a great resource for you to get going and help your pet sort of start to adjust to life. So, and that's what happened with my mom and Copper. He frankly didn't know how to deal with just normal, what we consider life when he first came to my mom. And so over time he's figured out what's okay and what's not okay. She's been able to help him deal with separation anxiety and things of that nature. And of course he went on the CrockPet diet, which was awesome because unfortunately he lost all of his teeth, but now he can eat happily. He's not painful anymore. And because it's already fairly soft, it's easy for him to eat and actually get into his mouth. So I know there's a few folks out there. I don't know if you guys have questions in particular. If you do, I'd love to hear them, love to see them. As I said, we're getting really excited about bringing Gracie home. So again, if you've got suggestions when you've worked with a deaf dog as far as training them, love to hear them. Hey Michelle, how are you doing? Glad to see you there. Would love to hear it. So I guess that's kind of the message for this week, is that if something is starting to change in your pet, we want to always make it the simplest thing, like he just doesn't like the food, so we'll switch to 6 different brands. But I can't tell you how many pups we've seen come in that the owner's done this for a couple of months, and they're just trying to make their pet happy, but unfortunately there's some underlying health issues. So veterinarians are out there for a reason. We did get trained really well in how to spot disease, and that's where your local vet can help you. We may not have all of the answers, but that's where folks like me, if you have somebody locally you can work with, that's great. If you don't, we've got some resources online for you as well at the website, theoriginalcrockpetdiet.com. So that's kind of what I know for today. We did have, there was a lady that wrote in about her pet and sort of what to do with kidney failure, and I think that's a common question. And again, what tends to happen is if you go to your veterinarian, your dog seems pretty healthy to you, you get blood drawn for your dog to make sure there's no underlying disease issue, and lo and behold, the kidney values are elevated. your veterinarian tells you, gosh, your dog is in stage 2 iris disease and is going to go into kidney failure and die eventually. And that's all true, but the fact that the dog is in relatively early stages of kidney disease, and so stage 2 iris disease means the creatinine hasn't gone over 2.6, 2.9, somewhere in that neighborhood. Often just switching to either canned food or cooked food, such as the CrockPet Diet, is enough to add more moisture in and actually bring those kidney values down. And what we've been seeing is that using CrockPet Diet and quercetin and a couple of other tricks sometimes, we're able to bring those kidney values back down into the normal range. And then more importantly, the SDMA test, which you guys may or may not have heard about. So it's a metabolite of arginine, which is a type of an amino acid. And this test is much more sensitive to detect kidney dysfunction than relying on creatinine and BUN and phosphorus. Those values don't become elevated until something like 65% of the kidney has been insulted or damaged. So SDMA is great because it helps us detect much earlier that there's an issue and allows you to take action, which in conventional medicine is putting your pet on a kidney diet which is lower in protein. So a lot of folks will write in and ask questions about that. And, frankly, I try to really wait to drop to a lower protein diet to see if we can give some of these other options a chance to work. And often just switching to cooked food and adding in quercetin, we're seeing not only the kidney values go back down to normal, but also the SDMA tests go to normal as well. And so that's just been awesome to see. And it's one of those things that it doesn't happen in 6 weeks. It's going to take 6 months. So the idea with being able to support the kidneys through more fluid and nutrition is that it decreases their workload. And then we use quercetin often because it helps to repair the basement membrane of the kidney cells, of the nephrons, and allows them to go back to functioning more normally. So the interesting thing is that the process of kidney failure happens when advanced glycosylation end products, otherwise known as age, and literally that's what ages you, scars the kidney cells. Hey Caroline, how are you doing? And creates problems as far as the kidneys not being able to work well. So if we support that kidney and stop that process of AGE deposition, then we can improve the kidney function back to where we're not able to detect any abnormalities whatsoever. So that's been an incredibly powerful and very inexpensive supplement with very few side effects. Many people know quercetin in combination with stinging nettles, which helps to reduce allergic reactions. So both of those plant substances helps to reduce circulating levels of histamine and take the itch out. But we love quercetin for its beneficial effect on supporting the kidney. So, and Michelle, thanks so much for saying that. I'm glad that these are helpful for everybody, and I'm glad that we're able to provide answers for some folks. So that's what I know for this week, and so I'm going to say goodbye from sunny Florida. We're going to take Copper over to the Botanical Gardens and check out the amazing orchids down here in Naples. So until next week, guys, hope you're doing well. Hope your pets are doing well. And and Michelle says she has a kidney kitty. So there you go. If you can get your kitty to eat, yes, and I think we've talked about your kitty too. Eat the CrockPet Diet, and I think that was not a problem for you. And yes, Deb, quercetin is very helpful for kidneys. What I was saying is that we've been able to take dogs and cats that are in stage 2 and stage 3 iris disease in some cases, and actually get those numbers to stay stable for years at a time, or even better, get those numbers to reverse back to normal, and the SDMA tests go back to normal too. So fluid is crucial for the kidneys, and we actually created a lot of bladder disease and kidney disease in cats because we turned these desert creatures that should eat, a mouse or something that is full of fluid into dry food eaters, which just doesn't work. And 19 and stage 2 kidney disease for a cat sounds horrible when you hear it from your veterinarian, but frankly, the mean survival time, if you follow conventional treatment, is something like 1,100 days. So I forget how many years that works out to, but that's like 3.5, almost 4 years. So I think it's important for kitties, and they're very difficult to get switched around on food. If your cat's not already eating canned food, to get them switched from dry food to canned food first, and then try to switch to CrockPet Diet. And there are some cats, and they're very stuck in their ways, as we all tend to be as we get older, that just won't buy into it. So you just have to work with what your cat believes is a good plan, and do the best you can. We've had some folks that were able, if they weren't able to get the kitty to eat quercetin by itself, we've been able to have some of the pharmacies compounded with a sweetened thing, and that's been very helpful. And that's great. Deb says that her kitty eats canned and raw food only. And I think that's, raw food has been closer to what cats probably should eat. You may see if she does a little bit better by cooking the raw food, because again, as we age, we don't produce as much digestive enzymes, and so sometimes a cat that's done well on raw food for a long period of time, or a dog for that matter, if we start cooking the food a little bit and sort of pre-digesting it, they do much, much better. So guys, that's what I've got for today. We'll see you next week at 12:30. Message me with questions, whatever, there's usually a post I'll keep this video post pinned to the top of the page, so if you've got questions for next week and you're not able to come to the live thing, just put them there and I'll get them answered for you. Have a fantastic day. Cheers.